We are seeing a significant shift in how stimulants are used. While Adderall, a combination of amphetamine, dextroamphetamine salts, is commonly prescribed to treat ADHD, it is increasingly abused off prescription for recreational use in healthy young adults who do not have ADHD. Young people frequently take Adderall sporadically and off prescription to boost their alertness, academic, and physical performance. However, a growing number of case reports link this sporadic Adderall use to acute cardiovascular events, including myocardial infarction, arrhythmias, and even cases of sudden death have been documented. I am Dr. Anna Svatikova, consultant in the Department of Cardiovascular Diseases at Mayo Clinic in Rochester, Minnesota. Our article, Acute Cardiovascular Responses to Amphetamine, Dextroamphetamine Salts, Adderall, in Adderall-Naïve young adults, a randomized clinical trial, is scheduled to be published at Mayo Clinic Proceedings in March 2026. Our study showed that consumption of a single dose of Adderall in healthy Adderall-Naïve subjects led to significant increases in their blood pressure, heart rate, and sympathetic activation, which may explain the elevated risk of cardiovascular events associated with illicit Adderall use. Given the rising use of unprescribed Adderall in adolescents and young adults, and potentially fatal consequences, we conducted a randomized, double-blinded, placebo-controlled study to examine acute cardiovascular effects of Adderall in 30 healthy, Adderall-naive young adults. Participants consumed a single 25 milligram dose of oral generic Adderall or placebo, and we measured their resting blood pressure, heart rate, and plasma catecholamines before and then 3 hours after consuming Adderall or placebo. 29 participants with a mean age of 27 completed both the placebo and active therapy arms. Our study showed striking increases in blood pressure, heart rate, and sympathetic activation after Adderall consumption. Specifically, in response to the relatively modest 25 milligram dose of Adderall, our participants' resting systolic blood pressure increased by 10 millimeters mercury, their heart rate increased by 10 beats per minute, and the fight or flight stress hormone norepinephrine went up by 40% even at rest compared to placebo. Adderall also induced surprising orthostatic changes. Systolic blood pressure fell by 7 millimeter mercury, while the heart rate surged by nearly 40 beats per minute upon standing. It is important to highlight, however, that in this study, we modeled and assessed the acute effects of illicit Adderall use in Adderall-naive participants, and our data should not be extrapolated to understanding long-term effects of Adderall that is prescribed for treatment of ADHD or other specific conditions, where considerable therapeutic benefits may be evident. We have seen an increasing number of emergency room visits due to non-medical use of ADHD drugs. Patients using recreational off-prescription Adderall may present with chest pain, palpitations, or rhythm abnormalities. Recent news reports also highlighted episodes of cardiac events in young investment bankers working overtime and using Adderall off prescription to stay awake and alert. The sudden rise in blood pressure, heart rate, and stress hormone we observe may play an important role in our understanding of why acute cardiovascular events may happen after recreational or illicit use of Adderall. As physicians, when we are seeing patients without traditional cardiovascular risk factors presenting with episodic chest pain or arrhythmias, we need to ask them if they are using any stimulants like Adderall. These can lead to significant cardiac complications, noting that even cases of sudden cardiac death have been documented. We need to be aware of the potential adverse consequences of recreational use of Adderall. Adderall may likely induce greater pressure and tachycardic responses when combined with other stimulants. Young people frequently abuse amphetamine drugs together with energy drinks to maintain wakefulness when studying, or combine them with alcohol or nicotine. In this regard, we have previously reported that energy drinks alone also markedly increase blood pressure and stress hormone norepinephrine. The combined effects of these stimulants may have profound adverse effects on the heart and may lead to rhythm abnormalities, ischemia, or other adverse cardiovascular outcomes. Furthermore, the cardiovascular consequences of illicit recreational use of Adderall in patients with an underlying heart conditions, such as structural heart disease, high blood pressure, or arrhythmias, may be even more hazardous. We must remain vigilant regarding the adverse consequences of recreational stimulant use. If you would like to do a deeper dive into the data, I invite you to read our full article in the March issue of Mayo Clinic Proceedings. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.